These are the cells that line your esophagus. They're soft, smooth, and designed to help food and drink pass down easily. But over time, when they are exposed to things like smoking, alcohol, or persistent acid reflux, this smooth lining starts to change. The constant irritation causes damage, and your body tries to protect itself by replacing these smooth cells with tougher ones. If this goes unchecked, these abnormal cells can turn into a cancer. There are two main types of esophageal cancer: adenocarcinoma, which usually happens at the bottom of the esophagus near the stomach, and it's often linked to things like acid reflux and a condition we call Barrett's esophagus. The other type is known as squamous cell carcinoma. This usually happens in the upper or middle part of the esophagus, and it is more common in people who smoke or drink a lot of alcohol. The type matters because they behave differently and they both need different treatments. Squamous cell carcinoma spreads faster and often responds better to radiotherapy. This is using high energy rays to kill cancer cells. In chemotherapy, this is using special drugs to stop cancer from growing. On the other hand, adenocarcinoma often needs more aggressive surgery. So, knowing what type it is helps doctors to figure out the best way to treat it and also gives us an idea of what to expect. Next up, our next fact. Symptoms can be subtle early on. Esophageal cancer doesn't always show obvious signs early on. One of the first things people notice is having trouble swallowing. This might start with things like bread or meat feeling stuck. Other symptoms include ongoing heartburn, losing weight without trying, and chest pain. If you notice any of these signs, especially if they don't go away, it's worth seeing your doctor. Our next fact. Barrett's esophagus is a key risk factor of esophageal cancer. Barrett's esophagus is what happens when the cells at the bottom of your esophagus change to cope with long-term acid irritation. It usually happens after years of untreated heartburn or acid reflux. While not everyone with Barrett's esophagus gets cancer, it does raise the risk, so doctors keep an eye on it with regular checkups to catch on any early changes. Next up, in our next fact, early detection saves lives. The good news is that if we catch esophageal cancer early, it's way more treatable. When found early, survival rates are higher and treatments can be less intense. That's why being aware of the symptoms and getting checked out if you have any risk factors like long-term reflux, smoking, or Barrett's esophagus can make a huge difference. If you enjoyed today's video, please leave a like and subscribe. And as always, I truly care about your health and I wish you the very best.